Welcome to your guide to administering epistatus to patients with prolonged acute convulsive seizures, or status epilepticus. A seizure can happen at any time. If you will be caring for a patient with epilepsy or believe that you may be required to administer epistatus in the future, you should familiarize yourself with their individual care plan. When a seizure starts, remove or loosen items such as glasses, ties and scarves, anything which is likely to cause harm during the seizure. Also remove anything surrounding the patient which could harm them, such as hard-edged furniture. Only move the patient if they are in a dangerous situation, such as by a road, near open water or hot cooking appliances. If the patient is not already on the floor, you do not need to place them there. Gently turn their head to one side. If there is someone else nearby, ask them to time the seizure. Otherwise, make a note of when the seizure started whilst you're preparing the epistatus and consulting the patient's care plan. If the epistatus liquid is cloudy or contains crystals, or if it is past the expiry date, do not use and call for an ambulance. Unscrew the child-resistant cap, keeping the bottle upright. Ensuring the plunger of the empty 1 milliliter syringe is pushed completely down towards its tip, insert the syringe into the center of the plastic bottle adapter in the neck of the bottle. Turn the bottle upside down, then slowly pull out the plunger until the oral syringe contains the correct dose, in accordance with the individual's care plan. Ensure there are no large air bubbles in the syringe before turning the bottle upright and removing the syringe. If the oral syringe contains any air bubbles, push the plunger back in and slowly withdraw again until the syringe contains the correct dose as prescribed. Put the cap back on to avoid spillage or evaporation. To administer the medication, support the head and locate the buccal area by holding the chin and gently applying downward pressure on the lower lip. Insert the syringe into the patient's buccal cavity. Do not put the syringe between the teeth. Push the plunger of the syringe slowly. Ideally, half the dose should be placed into each buccal cavity, but if the patient is lying down and access to the second cheek is difficult, administer the full dose into the uppermost cheek. Support the patient's head and gently close the mouth. Wait for 5 minutes for the epistatus to work and the seizure to become less active. The seizure should end within 10 minutes of administering epistatus. Patient recovery times can vary. Some recover quickly, others may remain drowsy for some time. If the seizure persists beyond 10 minutes or the patient's breathing becomes shallow or irregular, call an ambulance immediately. Once the seizure has stopped, and if the patient is seated, let them stay in the seat to recover. Alternatively, if the patient is on the floor when the seizure stops, put them into the recovery position. While the patient is recovering, refer once again to the agreed patient care plan, where you will find a space to record the duration of the seizure and the medication given.